It's a problem we've talked about before, but it's still a major concern for doctors. Prescription drug overdose deaths have diminished slowly, but now those addicts are turning to something worse. News 10's Patsy Kelly explains in tonight's Health Watch 10.
About 100 people will die each day from a prescription drug overdose, and almost 7,000 are seen in the ER every day for the same reason.
It is shocking, and it was shocking to me to review that data today. Recently, we were told that approximately 6 people die every day from alcohol overdoses. And so to see that approximately 100 to 120 people die every day from prescription drug overdose is shocking.
Dr. Kyle Turner says prescribing habits have changed over the last 25 years, and the number of drug overdoses reflects that. Unfortunately, doctors are judged on how well they control their patients' pain, and it's not helping addicts.
So hospitals and doctors have been judged on that, and as a result of that, we are more heavy on prescribing opioid pain medications rather than non-steroidal anti-inflammatory drugs like ibuprofen or Tylenol to start with. And by doing that, unfortunately, patients will develop addictions and who may not have been exposed to those drugs before, who did not try lesser medicines such as ibuprofen or Tylenol for pain control.
But it's not all bad news. The state of Indiana has new restrictions on prescribing practices, which are helping.
A New England Journal of Medicine article that just came out this week suggests that deaths are actually decreasing as we become more restrictive on our prescribing practices. And so there is hope in the future, but we certainly need to be aware of this problem.
And the doctors aren't just blaming you for this addiction, they're trying to prevent this from happening as well.
Patients need to communicate with their doctors, and as physicians we need to try different medications for pain control without jumping directly to opioid medications.
But now, because of these restrictions, patients are hitting the streets to get their meds.
And unfortunately what I'm seeing in my practice is that since we've decreased the number of prescriptions that we're giving for opioid medications, patients are now transitioning over to heroin abuse.
In Terre Haute with photojournalist Cody Murphy, Patsy Kelly, News 10.
With an uptick in heroin abuse, there's a lot of things that could go wrong, including increased cases of hepatitis C and HIV. News 10's Patsy Kelly will explain the connection between prescriptions and heroin tomorrow night on News 10 Night Watch.